Hello everyone. Today we are going to study multiple sclerosis. It is one of the important topic of third year neurology for the BPT students. Okay. Multiple sclerosis. Okay. So here at first we will know about the definition of the multiple sclerosis. Definition of multiple sclerosis. In short form of multiple sclerosis we can say it is MS. Okay, so MS or multiple sclerosis is a chronic autoimmune demyelinating disorder of the central nervous system. CNS. What is MS? Multiple sclerosis is a chronic autoimmune demyelinating disorder of the central nervous system that affects the brain, spinal cord, and optic nerve. Okay, so you can say it is a chronic autoimmune demyelinating disorder where the myelin sheath is demyelinated of the central nervous system that affects the brain, spinal cord, and optic nerve. Next, it is characterized by repeated episodes of inflammation demyelination and axonal damage leading to neurological deficit that are separated in time and space. So this is the definition of multiple sclerosis. It is a chronic autoimmune demyelinating disorder of the central nervous system which affects the brain, spinal cord, and optic nerves. It is characterized by repeated episodes of inflammation, demyelination, and axonal damage, leading to neurological deficits that are separated in time and space. Okay, next is the incidence. Commonly occurs between the age group of 20 to 40 years of age. Commonly. Next is it is more common in female age. Okay, more common in female rather than males. And lastly, it is called as the great crippler of young adult, because people normally become crippled at the young ages. Crippler of young adults. Okay, so this normally occurs between the age group of 20 to 40 years of age, more common in females, and called as the great crippler at the young adults. Next we'll go to the etiology. Etiology means causes. What are the causes behind the disease? That is known as the etiology. Okay. Normally the exact cause of multiple sclerosis is unknown. Normally unknown or idiopathic. The first cause is the idiopathic or unknown cause. Okay. Next one, number 2 is autoimmune basis. The autoimmune basis. What is autoimmune basis cause? Where the body's own immune or that is known as the antibody attacks the body. Okay. Normally here the immune system mistakenly attacks the myelin sheath of the central nervous system neurons. That's why uh, the T cells, B cells, and the antibody are involved. Number 3, genetic factors. Number 1 was the idiopathic factor, unknown cause. Number 2, autoimmune cause or autoimmune basis, where the body's own immune system or antibody attacks the body, where the immune system mistakenly attacks the myelin sheath of the central nervous system. The mainly here are the factors that T cells, B cells, and the antibodies are the main causative factors involved. Next one is the genetic factor, where the first degree relative have higher risks. Next, it is linked to HLA DRP1 gene, commonly asked in the exam. Okay. On chromosome 6. Number 3 was the genetic factor. Number 4, environmental factors or environmental triggers. Here in environmental triggers, number 1 is the viral infection. Normally EP virus. EP virus, that is known as the Epstein-Barr BARR virus. Okay. Next environmental trigger is the low sunlight exposure. That leads to vitamin D deficiency. Okay, next is the third environmental trigger point is the smoking is also a risk factor. Okay, so these are the etiology or causes of multiple sclerosis. Next we'll go to pathophysiology. At first, the immune system attacks the myelin sheaths. Next, this causes inflammation. Demyelination and formation of sclerotic plaques in the white matter. Next, the demyelination slows or blocks the what? Blocks the nerve conduction, because the nerve conduction occurs through the myelin sheath of the neuron. So the demyelination slows or blocks the nerve conduction. This leads to, over time, there may be axonal loss and neuronal degeneration occurs, leads to permanent disability. Okay, mainly this pathophysiology occurs in the brain, optic nerve, and spinal cord area. The brain, optic nerve, and spinal cord are the main sites affected. So this is the pathophysiology, where there maybe the root cause is the autoimmune basis or idiopathic basis. When there is infectious cause such as Epstein-Barr virus is the causative organism behind the multiple sclerosis. Here the pathophysiology will be somehow different. What's different? Pathophysiology, the viral cause, at first the viral infection may cause production of antibodies and macrophages, which produces cytotoxic effect in the CNS. Okay, which leads to this results in destruction of oligodendrocytes, which are responsible for the production of myelin sheath. Okay, then it's lead to the disruption of myelin sheath causes slowing of the neural transmission. And causes the nerve to fatigue rapidly. Nerve to fatigue rapidly. Then the demyelinated area gets filled with fibrous astrocytes and undergo a process called gliosis. resulting in formation of glial scar or plaques. So that's why it is known as the multiple sclerosis. When there is these plaques are multiple in number, in the demyelination process is called the gliosis, resulting in formation of the glial scar or plaques. Okay, so this is the viral. When there is the causative organism is the Epstein-Barr virus, okay, or EB virus. Okay, next we are going to study the classification of multiple sclerosis or types of multiple sclerosis. Types of MS. Okay, number one is the relapsing remitting multiple sclerosis. Or RRMS, the relapsing remitting multiple sclerosis. It is the most common type of multiple sclerosis. Here the patient has clearly defined attacks, means relapses, where relapses of the attacks occurs, followed by partial or followed by partial or complete recovery, that is remission. So that's why it is known as the relapsing remitting multiple sclerosis. Okay, number one. Next one is the number two is secondary progressive multiple sclerosis. Secondary progressive multiple sclerosis. It's initially starts as RRMS or relapsing limiting multiple sclerosis, then gradually worsen without clear relapses. Number 3, primary progressive. PPMS. It's steadily worsening from start without any relapses. Distinct last, number 4, is progressive relapsing. PRMS. Progressive relapsing multiple sclerosis. It's steadily progression with superimposed acute relapses. So these are the 4 types of multiple sclerosis: relapsing remitting multiple sclerosis, secondary progressive multiple sclerosis, primary progressive, and progressive relapsing multiple sclerosis. Next we will go to the clinical signs and symptom or clinical features. Features or signs and symptoms. The multiple sclerosis symptoms vary depending on which area of central nervous system is affected. The symptoms may be intermittent, progressive, or relapsing. The common symptoms include number 1, visual problem. At first, there may be altered visual acuity. Next, there may be optic neuritis, which is the painful loss of vision. Next is scotoma. What is scotoma? A dark spot may occur at the center of the visual field. Next is Marcus gun pupil. Next, double vision or diplopia. Or double vision. Next, loss of color vision. These clinical features may vary according to the areas involved. Okay. Next one is nystagmus. When it occurs due to lesion in the cerebellum or central vestibular pathway. Next, internuclear ophthalmoplegia. Ophthalmoplegia. INO. What is this? Incomplete eye adduction or lateral gaze palsy on the affected site. And nystagmus on opposite side. Okay. Last is consensual reflex. What is the consensual reflex? It is shining a bright light in the normal eye causes contraction of pupil in both the eyes, while shining a bright light in the affected eye produces dilatation of both pupil. But is shining a bright light in the normal eye causes contraction of both pupil, but while shining the bright light in the affected eye produces dilation of the both pupil. That is known as the consensual reflex. So these are the visual problem or visual sign symptoms occurs due to the multiple sclerosis. Next one is number 2, motor impairment. What are the motor impairments occurs in multiple sclerosis? That is especially the signs symptoms of the upper motor neuron lesion. Signs and symptoms of upper motor neuron lesion. Okay, where there is muscle weakness, or paresis, leading to total paralysis. Next is spasticity. These are all the human. Next one is there may be clonus, positive Babinski sign, exaggerated deep tendon reflex or TTR, easy fatigueness, difficulty in walking or ataxia. There may be postural, intentional tremor, dizziness, vertigo, and disturbance in balance. There may be dysarthria, dysphagia, dysmetria, dystiadochokinesia, and staggering gait. So these are the motor impairments occurs in multiple sclerosis. Next, number 3 is sensory impairment. What are the sensory impairment? Number 1 is paresthesia. What is paresthesia? It is a pin and needle sensation. Next one is tingling or numbness. That is hyposthesia. Next, loss of kinesthetic sensation. Next, dysesthesia. That is abnormal burning or aching like pain. The next is hyperpathia. What is hyperpathia? That is hypersensitivity to minor sensory stimuli. Next, trigeminal neuralgia. What is trigeminal neuralgia? It is short stabbing attack of facial pain. Next, chronic neuropathic pain. Last is Hermit sign. It is important. LHERMITTEE. Hermit's sign. This is important for MCQ for exam and practical question. What is Hermit sign? Where is the L doesn't spells out? What is Hermit sign? It is electric shock like sensation on neck flexion. Okay, so you can say by flexion of the neck produces shock like sensation along the spine and lower extremity. So that is Hermit sign. Next one is the number 4. Cerebellar signs. What are the cerebellar signs? There is gait imbalance, there is intentional tremor, and dysarthria. That is slurred speech. These are the cerebellar. Next one is there may be cerebellar signs where there is gait imbalance, intentional tremor, dysarthria or slurred speech, and there cognitive and behavioral impairment. There is deficit in memory, attention, concentration, reasoning and planning, emotional disturbances, depression, mood swing, euphoria, fatigue. The fatigue is the most common in every MS cases, where 75 to 95% cases sees the fatigue occurs in the 75 to 95% cases of the MS. Next is the bladder and bowel dysfunction. In bladder bowel dysfunction, there is small spastic bladder, big flaccid bladder, dyssynergic bladder. In these three bladder, the symptoms are the urgency, frequency, nocturation, dribbling, and incontinence. Next is bowel dysfunction, that is the constipation, and there may be sexual dysfunction. And last is the heat sensitivity. The MS symptoms worsen in exposure to the heat, that is known as the Euthop's phenomenon. Okay, so these are the signs, symptoms, or clinical features seen in the multiple sclerosis. Next, we'll study about the investigations. Number one is MRI of brain and spine. Here it shows plaques, that is the lesion in periventricular juxtacortical infratentorial and spinal cord area. The MRI of the brain and spine shows the plaques or lesion in the periventricular, juxtacortical, and infratentorial and spinal cord area. It is the best test for the demyelinating lesions. Okay, number two is lumbar puncture or CSF, cerebrospinal fluid analysis. It shows oligoclonal bands What is this? It is the immune response within CNS. Next, elevated IgG index. Next, number 3, evoked potential. The visual evoked potential or VP detects delay conduction in optic nerve. Next one is somatosensory or auditory evoke potential. It may also be abnormal. Number 4, blood test. It is used to rule out other causes, just like lupus, vitamin B12 deficiency. The blood test may be carried out to rule out the other causes like systemic lupus or vitamin D deficiency. So what next is the differential diagnosis. Differential diagnosis of multiple sclerosis are neuromyelitis optica, CNS vasculitis, vitamin B12 deficiency, systemic lupus erythematosus, sarcoidosis, acute disseminated encephalomyelitis, ADEM. So these are the differential diagnosis. Next is the medical management. In third year, you will only have to write the medical management. But in fourth year, that will in addition to this, there will be PT management, PT assessment and PT management. The treatment mainly focuses on the number 1, acute relapse management. Acute relapse management include high dose corticosteroid, that is methylprednisolone, for 3 to 5 days. It helps to reduce inflammation and shorten attack duration. Next, number 2, disease modifying therapy. That includes the interferon beta, glatiramer acetate, fingolimod, dimethyl fumarate, natalizumab, alemtuzumab, for severe case. Next, number 3, symptomatic treatment. For muscle spasticity, baclofen is used. Rather than baclofen, tizanidine is also used as a spasticity reducer. For fatigueness or muscle fatigueness, amantadine or modafinil is used. Amantadine or modafinil is used. For pain reduction, gabapentin or pregabalin. For bladder bowel issue, anticholinergic drug. For depression management, SSRIs are used. So these are the medical management of multiple sclerosis. Lastly, we'll go to the complications occurred due to the complications, mainly progressive disability occurs, wheelchair bound in advanced stage, wheelchair bound, in advanced stages. Next is severe fatigueness and poor quality of life. Next, depression and emotional disturbances. Instability. Next, urinary tract infection. From catheterization. Next is osteoporosis from immobility. Or steroid use long term. Pressure sore or breast sore. Or pressure ulcer. In bedridden patient. Respiratory complication. In late stage. Okay, so these are the complications seen in the multiple sclerosis patients. So this whole topic of multiple sclerosis you will see in the third year. In addition to this, in fourth year, in addition to this, you will have to read about the assessment of PT assessment, physiotherapy assessment, and physiotherapy management. Okay, we'll study this on the next class.